Matters Health, the AIDS Healthcare Foundation Kenya, in collaboration with key civil society organizations, have urged wealthier nations to stop hoarding the Mpox vaccines, stating that this has limited the supply of the vaccines in the African continent, where the disease has had the most impact. And as Elizabeth Atieno now reports, the government has been urged to leverage on technology from regional vaccine production.
On the 13th of September 2024, the World Health Organization approved the MVA-BN vaccine manufactured by Bavaria Nordic. However, a section of stakeholders in the health sector are now raising concerns over a sinister plan by the developed nations to hoard the vaccine, a situation which is limiting the supply in the African continent, which is the most affected by Mpox.
We have seen the devastating effects of vaccine inequality during the COVID pandemic. The vaccine hoarding by wealthy nations resulted in more than 1.3 million preventable deaths.
Another thorny issue is the high cost of the Mpox vaccine, which is projected to cost 13,000 Kenya shillings per dose.
So this high cost of vaccine is not only an economic issue, it is a life and death matter.
The health stakeholders have called on the World Health Organization to also approve the LC16 vaccine for use by African countries in a bid to increase the number of manufacturers in the market.
LC16 vaccine has been approved and in use in the US and European countries and remains unapproved for use in Africa.
Even as Kenya prepares to procure 2 million doses of the MVA-BN vaccine, a call has been made to the Ministry of Health to target people living with HIV, commercial sex workers, and other members of the key population in the vaccine rollout.
Secure vaccines and have a clear focus on those most at risk, including sex workers and people living with HIV.
Important to note that 41% of reported cases are of children below the age of 15. Also important to note that of all reported cases, 63% are men.
Recently, the Ministry of Health revealed that it will need 6.7 billion Kenya shillings on the management of Mpox. A call has been made to the government to uphold authenticity and transparency.
Although Kenya shillings 1.6 billion has been allocated to address the Mpox outbreak, only a paltry 7.4% of the budget is dedicated to infection prevention.
We need to mitigate. We know we had COVID millionaires. So we need to be ready to mitigate Mpox millionaires.
In Kenya, there have been 5 confirmed cases with the counties of Taita Taveta, Busia, Nairobi, Mombasa, and Nakuru reporting 1 case each. Elizabeth Atieno, TV47.